The chapter of today, with which I'm entertaining you for a while, is Bunion or Hallux Valgus. Hallux Valgus is a deformity of the first ray at the metatarsophalangeal joint. The deformity is progressive and it becomes painful with time. Surgery is always needed when a certain degrees of deviation is acquired. The causes of hallux valgus and bunions is not certain. Deformity of the rear foot in valgus and overload of the metatarsal head may be implicated in the deformity. Definitely a cavus foot or high heel walking will help developing hallux valgus. Bunion or hallux valgus most of the time is painful, and this is the cause of referral to orthopedic surgeon. But bunion and hallux valgus can be congenital as well, and you must exclude different genetics or associated disease with that. The bunion look like a hump on the medial part of the metatarsophalangeal joint, then can become swollen, bigger than the rest of the joints of the foot, and completely red and painful. It's difficult to choose the real and the best shoes for hallux valgus. Of course, high heel shoes and pointing shoes are more difficult and painful to wear. Trainers and sport shoes or flat shoes are normally used because they become more comfortable for the patients. The bunion that forms when hallux valgus is present is a hump on the metatarsophalangeal joint that can be full of water, and this is called bursitis, and this is when it's mostly painful. Anti-inflammatory, ice therapy and rest are the best treatment, non-surgical, to get rid of the pain. The treatment for hallux valgus is at the beginning conservative with splints that keeps the hallux straight. Most of the time the hallux become painful and deviated, and the only way to resolve the problem is surgery. Most surgery is described to correct hallux valgus, and each surgeon decide according to the deformity of the presence of arthritis which one is the best for each case. When surgery is needed and performed according to different technique, the recovery time can be from 1 month of non-weight bearing in a plaster, or with minimally invasive surgery, weight bear with a special shoes after a couple of days. So it depends on the deformity and the surgical skill of the surgeon on how much the patient can weight bear on the operated foot and when. In the last 30 years, I have performed nearly 15,000 surgery on hallux valgus, both in adults and children, with good results and restitution to walk in about 1 week time, and back to sports in 3 to 4 weeks time. I'm always available for any question, any doubt, or any problem you may have, because I understand as a father that every minimal problem with your kid can become a major disaster in your mind, and it's better to have a straightaway answer and clarification so you can relax for something that is normally not important. I'll be happy to answer you on the YouTube channel anytime you write.